going to start with discussion, which is an update regarding the novel coronavirus in the United States. I'd like to turn the management of this discussion, which we've allocated roughly 15 minutes, to Mr. Weeder.
Thank you, Mr. Chair. Coronavirus is here. Coronavirus will usually have a devastating effect globally, and coronavirus is real. Right across the bridge, real. People walking with masks in Rockland County is probably soon going to be a very common occurrence. And we'll see. It's going to become part of our daily lives. Therefore, I would like to thank the Commissioner of Health for coming to the Legislature and give us a brief presentation about what we are up here in Rockland County against, and what the county has done and her department has done to address this terrible, terrible disease and virus.
Good evening, everyone. I'm glad to be here to discuss such an important topic with you. I appreciate seeing you all at once and discussing this at one time, not with a committee of 7. It's very important that everyone hears this, so thank you for that. Emerging infectious diseases are a major challenge in the 21st century. In recent years, worldwide outbreaks of Ebola and MERS have caused great health and economic losses. The ongoing new coronavirus pneumonia, which is coronavirus disease, COVID-19, is highly similar to the severe acute respiratory distress syndrome, SARS, that occurred back in 2003. Both outbreaks were caused by new coronaviruses during time periods that overlapped with the Chinese Spring Festival. In December, the Wuhan Municipal Health Committee reported 27 cases of pneumonia with an unknown cause, and many were traced back to their seafood market that was subsequently closed on January 1st, 2020. On January 7th, laboratory tests showed that the pathogen causing the previously undetermined pneumonia was a new type of virus called the coronavirus that WHO, the World Health Organization, has now named COVID-19. This outbreak started in Wuhan and then spread to other provinces and countries. I'm going to give you some numbers today. First of all, I want you to understand that coronaviruses are a family of viruses. Some cause very mild illnesses like a cold, upper respiratory infection. Others cause severe pneumonia. There are about 6 species that cause disease in humans. 4 of them are now endemic in human population. Those coronaviruses cause upper respiratory infections, along with other types of viruses, adenoviruses, rhinoviruses, enteroviruses. One of them causes MERS and one causes SARS, so that's your 6. Infections, though, with this new virus have been reported now in many countries, including the United States. Commonly reported symptoms include fever, cough, shortness of breath. Most people, though, who have COVID-19 have a very mild illness. They'll feel flu-like. They can even have some fatigue, myalgias as well. About 15 to 20% require hospitalization. Those that are most at risk for severe illness are those that are elderly or those that have comorbid conditions. Globally, as of tonight, and it changes frequently, we have 92,315 cases in the world. China has over 80,000 of them. There have been more than 3,000 deaths. China has almost 3,000, 2,945. In the United States, as of 6:30 this evening, we have 126 cases. We've had 9 deaths. Many of the cases we have are from the Diamond Princess cruise ship, but the others now, especially the newer ones, are not from that. We have about 47,000 people who have recovered from this illness, and we've also seen expanded transmission now in South Korea, more than 5,000 cases, in Japan, in Iran, and Italy. And both Iran and Italy have more than 2,000 cases each. We do have evidence of community transmission in this country. We do have a rate of what we call an R0. That's a rate of infectivity. So if one person has the virus, how many people would get it from that person? That number is over 2 at this point. We need it to be under 1 to end this. Based on early data from China, about 80%, like I said, have very mild symptoms. Many people probably don't even know that they had it or think they had an upper respiratory infection or flu-like illness. The case fatality rate at this point is between 1 and 2%, and those numbers may change over the future, and it actually may drop. We have different criteria now that have been revised to guide evaluation for patients under investigation. So that's the patients that we then proceed to test. And that has to do with their exposure to a person, if they're a healthcare worker who's been exposed, if they travel to the affected areas, and for some where there's no source of exposure, but they're not responding to, for example, treatments for pneumonia. We've had containment strategies to date. They have been successful. Travel restrictions, airport entry screening, where Customs and Border Protection and CDC screen passengers that are returning from China for symptoms. We have movement restrictions and monitoring of people that are at high and medium risk. We have monitored 26 people in this county. I have 2 I'm monitoring presently. The others are off monitoring already and were not symptomatic during their time. We have lab tested those who have had increased risk and who have been symptomatic in the state. We have not had that in the county so far. So the goal of containment strategies is to rapidly identify new cases and to limit secondary transmission to persons who are under isolation so that exposures are limited and transmission chains are suspended. And that's the intention. We've been working very closely with CDC, with New York State Department of Mental Health, even with the City Mental Health Department and Department of Health itself to evaluate what needs to be done. This is evolving. It changes from morning to afternoon every day. So we've had airport screening, the isolation and quarantine, the monitoring of individuals, laboratory testing, public education. We have our website has been changed multiple times already and will continue to be changed as needed. And we have a hotline, a state hotline for information for the general public, and then our own numbers for the healthcare providers in the county. The governor had requested and had been approved last night for $40 million in supplemental appropriation that was signed by both houses at midnight. Governor Cuomo did sign that in today. So that additional funding will be used to hire staff, laboratory staff, epidemiologists, communication, education, and preparedness staff. It will be helpful to buy equipment and supplies like our personal protective equipment, lab supplies. It'll be helpful for communication and media, and it will help us here at the local health department as well. The time is going to come because these cases continue, and we will be in the country, and we will, I'm sure, see cases in this county, that we will have to have a dual simultaneous response strategy. So aggressive containment, case-based control measures. That means when we find out that there's a case, we investigate to see where this person has been, who their contacts are. We can't even test for immunity like we did in measles and check for vaccinations because there are none at this point. And then we have to prepare non-pharmaceutical interventions and community mitigation. And yes, that does mean probably strategies that will at some point may close schools, may have early dismissal at schools before a holiday period of time, may have where the staff goes into the school and teleeducate students at home. We may have to close down just certain schools if there's a high number of infection in those schools. There'll be different things that need to be done as time goes on. We're not there yet. We do not have cases in Rockland County, but we are preparing. We are reviewing our community mitigation guidelines for pandemic flu. This does apply in this case because it is a respiratory virus as well. We want to reduce the societal impact of a pandemic. WHO has not yet declared this virus as a pandemic, but may do so very soon. So we are now working with our communities, with our providers, with partners to educate, to inform, as I'm doing with all of you tonight. And I'm here to answer questions if you would like to ask some. I'm here, I guess I have a few more minutes. Thank you.
Thank you, Commissioner. for this presentation, and this will open this up for questions from legislators. So first, I would like to ask the Commissioner, are our local hospitals ready to deal with this virus when, and not if, it comes
Yes.
to Rockland County?
Yes, they are.
Do they have an isolation unit?
Yes.
Both hospital, Good Samaritan, and
Good Samaritan and IAC, yes.
the other today I went out to look for masks.
I'm sorry you went.
I went out to look for masks.
Why? Why? May I ask why?
I'll call you after the meeting.
No, I want to answer it now because everyone should. You don't have to answer. Let me just say, and I should have probably addressed this in my comments before I finished. So I'm glad you brought it up. When I saw you put the mask on before, and I understand why you did, and it's your business what you buy in the store. Let me just tell you, the Surgeon General, among others, have suggested and actually strongly recommended that people in the general public do not go out and buy masks, do not wear masks. It doesn't do anything. What it does is when they are utilized, I'm talking by the community members, all it really does is prevent someone who's already ill from having those droplets, having when you cough or sneeze or talk, approach others. The N95 masks, which are those that are fitted and used for health care, are not the type that you buy in the store, and not that you would need that. The regular masks, procedure masks, surgical masks, if you want to call them that, really are not recommended to be used by the public. They really don't help you not get infected unless you're already sick, and then we do place a mask on the person while we're evaluating them, but not in the general. Again, you can do as you wish.
I went out today to see if I could buy a mask. I went to a few stores. All of them were out of these masks, and they told me that their suppliers have told them as well that they are out of the masks. Now, given the information that you have just presented to us, that when it comes, it would be recommended that those who are infected should have the masks, or those who come in contact with those who are infected. Have you looked into this matter, that there shouldn't be a shortage, or is there a shortage, or the hospitals, they have the masks that will be needed when it comes?
So again, if someone is ill, they should be at home, and that's called isolation, or in the hospital if they're that ill. Someone who is not ill, who is quarantined, should also be home, being monitored or self-monitoring for an illness to occur. None of them, neither of those, need to wear a mask unless they're specially advised to.
We know if the masks are available, and if there is a shortage for them.
I heard there's a shortage because people go out and buy them who don't need them.
So there is a shortage for masks.
I heard that it's difficult to get because people buy them who don't need them.
Are you concerned about that?
I'm concerned that people buy them who don't need them.
But you're not concerned that there is a shortage?
Of course I'm concerned if there's a
Now,
shortage.
my question, the next question I would like to ask you, the county put out, guidelines or information that people can find online?
Yes. Our website is, like I said, it's updated, current. It will continue to be updated. You can check the site.
You've mentioned before about a hotline. Can you tell us what a hotline is?
A hotline is a phone number that you can call.
What is the number?
Oh, I can send it to you. I don't have it with me here.
You don't have the hotline number?
No, I don't have it with me. I have it in the car.
Okay. It would be helpful.
I can send it to your secretary.
Yes, please do.
Sure. Oh, by the way, it's on our website as well.
Good. Okay. Have you ever heard of the Dr. Peter Daszak? He's the foremost doctor, and I believe that he discovered. I believe that he was very involved with this, other infectious disease, and he lives right here.
What's the last name?
Daszak.
No.
I believe that he discovered some infectious disease, and he's appeared on.
Which infectious disease did he discover?
He was involved. He was on CNN.
Which infectious disease?
I'll send you the information.
Good. Okay. So what's the question?
My question is, he lives here in Rockland County. Well, you answered my question. You haven't been in touch with him. It would be very helpful to be in touch with him, and I'll send you the information.
Why?
He appeared on national TV, and he seemed extremely knowledgeable and engaged on a federal level. And I believe it will be a treasure that he lives right here in Montebello. That for the Rockland County Health Department to be in touch with, it could be of help.
All right. Send me his name. But we follow the CDC and the state health department. But go ahead.
Have you been in touch with Westchester's health department?
Yes. Probably about 2 hours ago.
What about state and federal level?
Every day. Multiple times in the day at times.
Legislator Hanel?
I just wanted to thank Dr. Rupert for the presentation, which was very good, very straightforward, and we thank you for coming.
Dr. Rupert, thanks for coming tonight. A little quick question. I see a lot of people have recovered. What was the secret for the recovery? Is there any secret formula for that?
What we're finding is most people have a very mild illness, very mild form, and most probably they're the people that have recovered. Those that have underlying medical conditions, chronic medical, pulmonary issues, cardiac issues, they tend to be, much older, tend to be those that have more complications. Doesn't mean they can't recover, but those are the people that we've seen have had more serious issues. And by the way, more men than women, this is in China, have been affected by this. And if you look, more men than women, many more men than women in China smoke. And smoking is felt to be something that affects their lungs. Time will tell, and more research, but affects their lungs and probably puts them at higher risk, which makes sense. Right?
Thank you.
So not smoking is a great idea.
Legislator Salsa.
Start again. I want to thank you for coming down, okay, and making such an intelligent, good presentation. I was just wondering, the medical profession, how are they, their associations holding seminars to enable them to recognize the various things that would bring this on?
Yes, they are now hold those types of seminars, but a lot of the education and information comes from public health, and we are providing that, and we will continue to do that. Thank you.
Thank you. Any other questions? Okay. Thank you, Commissioner, for coming. I will caution you that during the measles outbreak, there were those who felt that they were being targeted, and when this is going to have a certain effect to Rockland County, I will ask you to be very patient, fair, throughout the whole county, and so people should be put at ease.
So I'm glad you brought that up before I leave. I want you to know very clearly, for anyone else who misunderstands, that the health department does not target anyone. If people felt like that, that was their perception. That was certainly not intended. For the population, as you well know, in the geographic region where we saw the measles cases, we did our damnedest. We did our utmost to take good care of those patients. We were able to offer vaccine. We were able to offer post-exposure prophylaxis, including immunoglobulin, lots and lots of meetings and education. We went out in the community. We went to the homes. We went to the community centers. We took samples from people in their homes. We did our best. So for anyone to think that, I'm glad to have publicly state that was so erroneous. We do not target anyone. We took very good care, and had we not taken that good care, that would have been targeting a population.
Perception is everything. If my office got phone calls that people got letters from the health department, they're scared to come down and they asked me to come with them, something went terribly wrong. So I appreciate that you're going to be on the forefront on it, and we need to be extremely mindful to every community that they shouldn't feel they're being targeted. And I appreciate and I thank you for coming.
And I will make one more comment in response. For the case that you're talking about, I sent a subpoena. No names, I will never mention names, but I sent a subpoena because we were not getting information that we needed for a case investigation that was required. I don't like to do that, but I had to do it, and that is what forced the person, with whatever assistance they utilized, to come in and give us the information we needed. This was a serious illness. So, Legislator Weeder, please understand something. You brought it up.
Folks, I think what I'd like to do is, I think we're getting off topic here.
The topic is that we will not target anyone.
I understand.
I'm finished. Thank you.
I appreciate you coming here, Commissioner. Thank you. We're going to move on from this discussion. Mr. Weeder?
I'm happy to do it, but I do not want comments of this type stated in public.
Thank you, Commissioner. Thank you, Commissioner. Mr. Weeder, if it's on topic, we're not doing it back and forth anymore.
No.
We're moving on from this.
I think it would be important that the Commissioner should be here, but I would like to ask the Tourism Director. To come and address the Committee of the Whole. And I think it would have been important for the Commissioner to be here. But
Mr. Weeder, she had to leave. We're already now we're 25 minutes into a 15-minute discussion, so if we can try and bring this to a conclusion.
So,
thank you.
I went on the county's website, and I went on the tourism website. And the only other language, at least what I saw, was Chinese. Now, I know the Commissioner just given us a presentation and told us that 80,000 cases of the coronavirus has been diagnosed in China. I just want you to tell us what is the county doing as far as making sure that, when we try to get more Chinese tourism to Rockland County, are we doing something about it as far as the coronavirus? And secondary, if we're going to stop all of that, how is that going to have an impact on the work that you have been doing?
How is it going to have an impact on
the tourism efforts that you've been doing up until this point to target the Chinese market?
Yeah, just to be clear, we're not doing anything. We're pausing since the last time I appeared before this body. The work has been done. The campaign is halted. We haven't, in fact, started the campaign, so whatever you saw was from before. And we're not going to do anything, obviously, with respect to that campaign until things change. Period.
But thank you.
Okay. All right. Thank you, Mr. Weeder. Thank you very much. We're going to move on to the next one.